begin.
Thank you, Denisha. Would you call the roll, please?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Russell Crutchfield,
Here.
Cynthia Rucker,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Melba Lee,
Here.
Shane Mobley,
Here.
Robert Coles. Again, I'll ask for Robert Coles. Chairman, that concludes my roll call.
Thank you, Denisha. And that does constitute a quorum to conduct business attending. We appreciate all of the board members taking time this morning to participate in our board meeting. We are in a new room here this morning, and I've been assured that technology will all work, and hopefully it will. I noticed one of the things we've noticed here that we don't have microphones on the table anymore, and the microphones are actually in the ceiling, and they wear a green light when they're on and a red light if they're not on. So this is an advancement in technology. So we're looking forward to having a meeting today without interruption as we did last time. I'll call the meeting to order, and the first order of business is the minutes of the previous meeting, which were brief due to the fact that we had to cut the meeting short, and I think we approved one item, and I'll ask Dr. Rucker if she's had a chance to look at those minutes and can recommend approval.
Yes, Chairman, I have reviewed the minutes from our prior meeting, and I did find that they were in order, and I do recommend approval as stands.
Minutes for the meeting have been recommended for approval. Is there a second to that?
Russell Crutchfield, second.
I approve.
It has been seconded. All in favor, say aye. Aye.
Aye.
Aye.
Opposed? Abstaining? Minutes are approved. Our agenda today has several items on it. There are 2 items that we'll be asked to vote on as a board that are up for final adoption, and 2 items that will be presented for initial adoption and other presentations for information of the board. So we'll move right into the agenda and the committee reports. We did not have the opportunity to have the Care Management Committee report last time, so I asked Anthony Williamson if he would please give us a report from that May 11 meeting.
Yes, thank you, Chairman Boyd. It was a good meeting. We focused mostly around the topic of the continuous enrollment period having ended, and all of the work that we are doing focused on getting our Medicaid enrollees re-enrolled, 14-month process for that to occur, with the goal of having that completed about a year from now, or May of 2024. A lot of education being provided to our providers on what they need to do during this period, and a lot of efforts, various efforts being made to reach our enrollees through various channels and get them re-enrolled. And the fact that the public health emergency was, ending on the 11th, May 11th of this year. And that was the bulk of what we focused on and covered during our May meeting.
Are there questions from the board on the audit committee report? Hearing none, thank you, Anthony. Next, we had the audit committee meeting this morning prior to this meeting, and I'll ask David Cruz, committee chairman, to give us a report on that committee meeting.
Thank you, Chairman Boyd. This morning's meeting was focused on the audit for the year, fiscal year ended June 30th, 22, the state fiscal year FY 22. Inspector General Sonia Allen Smith made the presentation reviewing the 11 audit findings from that report that was done by the Department of Audits. Of the 11 findings, only 3 were new findings. The other 8 were repeat findings. Sonia went through each of the findings and presented the department's response to those findings and plans to address those findings, including an estimated completion date for addressing the findings. 6 of the 11 will be addressed by the end of this month, June 30th. All of the findings will be addressed by the end of the calendar year. Of the 3 new findings, the department intends to have those rectified by all of 3 of those by mid-October. So that we heard that the department is making good progress addressing the findings. Joe Hood was present also and answered questions and made some clarifications. So we had a very good meeting, and we'll follow up on those findings at our next quarterly meeting.
Any questions from the boards or comments for David? His audit committee report. Hearing none. Thank you for that, David. And next item on the agenda, I'll turn it over to Commissioner Noggle for her report.
Good morning. Thank you, Mr. Chairman and members of the board. We are in a different room again today. So thank you for accommodating that. And again, apologies for technical difficulties in May. Our official boardroom is still under construction downstairs as they try to rectify and finalize technology solutions. But we do hope that within the next month or 2, that room will be completed and AV functioning. And at that point in time, we look forward to welcoming back any of our board members that would like to attend in person, but also we'll look to reopen our meetings to the public for in-person attendance as well. We anticipate keeping both a virtual and in-person option available going forward, but we'll share more details once that construction is completed and we have space to accommodate folks. But thanks for your patience and bearing with us. This is traditionally and a very busy time of year for the department, and this year is no different. Lots of things. I'll share a couple of updates, but quick shout outs to a couple of our team members that are particularly busy currently. Obviously our Medicaid Director, Lynette Rhodes, that you'll hear from shortly with a few updates. As you heard Mr. Williamson comment on our continuous enrollment, Medicaid unwinding efforts continue in earnest this month, and you'll continue to read and hear about those efforts over the coming months and weeks. Her team, John Hallman, who is a deputy at DCH and in charge of that process from their end, has been a fantastic partner to work with thus far, stepping into that role pretty late in the game, but is working very diligently to get up to speed and support us in that effort. So kudos to him, not only on that, but also on our efforts toward launching our 1115 Medicaid waiver or Medicaid expansion, Georgia Pathways to Coverage. We are still fully on track to implement that beginning in early July. Officially, we'll push that into production on July 1. We are having conversations multiple times a week with CMS, but feel very confident about where we are and our ability to provide additional coverage options to our Medicaid members, especially during this time of Medicaid unwinding. So kudos again to both our Medicaid team, the DFACS team that is working to support those efforts. They are both independently significant lifts, but doing them together at the same time is monumental, and appreciate everyone's efforts there. We're also winding down year-end financials. preparing for FY '24. Terry Conrad and his accounting and finance team are hard at work, along with under Joe's leadership, getting us squared away as our budget team as well. And we'll obviously in the coming months have budget information for the board to review in August as normal, but certainly a busy time of year. Couple of just FYI notices for the board that are not on your agenda because they don't require formal action by the board, but notices that we will post and provide public comment for as at the request of CMS, really related to COVID-19. CMS is requesting that states reaffirm our commitment to continuing to provide both treatment, testing, and vaccination for COVID-19 for 1 year beyond the end of the public health emergency at the federal level, which ended in May. And so we'll post our public notices and that we will continue to provide those options and services to our Medicaid members here pretty shortly. Again, no real approval required, just a reaffirmation that those services will continue. And then, as I always like to do, just want to recognize a couple of employees that are celebrating milestones in June. Baran Erdick in HFRD is celebrating 5 years of state service. Shakina Lampley in our budget office celebrating 10 years. Russell May and Tamisha Wallace, both within Medicaid, are celebrating 15 years of service with us. And James Peoples in Medicaid is celebrating 25 years of service. And if you don't know James Peoples, I encourage you to reach out to him. He is a rock star. So thanks to all of them for their service and commitment to the department and the state. We couldn't be doing this without them. Happy to answer any questions, Mr. Chairman, but that would conclude my update for today.
Thank you, Commissioner. Are there questions or comments for the commissioner from the board, please? Hearing none. We will move on to the items that we'll consider for a vote for final adoption, and call on Sonia Allen Smith to make a presentation. She has 2 items to present for final adoption as our Inspector General. So Sonia, it is all yours.
Thank you. Good morning, Commissioner Nago, Chairman Board, and other board members. Today, I will present 2 rules for final adoption. The first is the Georgia Caregiver Registry Rule, Rule number 111-8-13-.05. The purpose of the Georgia Caregiver Registry is to allow private families who are relatives or guardians of elderly persons to obtain an employment eligibility determination from DCH for current or prospective employees. These applicants or employees usually provide personal care services to their employers, family members, or wards. This amendment updates the mailing address for appeals and references and online administrative form through which the applicant or employee may request an appeal. An opportunity for public comment was held on May 10th, 2023. Written comments were due on or before May 17th, 2023. We received no oral comments and no written comments. That said, I am requesting your support for final adoption of the recommended rule changes to the Georgia Caregiver Registry, Rule 111-8-13-.05.
Thank you, Sonia. Are there questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Roger Folsom, motion for approval for final adoption, Mr. Chairman.
Roger Folsom has made the motion for final adoption. Is there a second?
Second, Cynthia Rucker.
Dr. Ruckers has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? It is approved. Thank you, and you may proceed.
Second rule that I would present is the estate recovery rule. Rule number 111-3-8-.05. In Georgia, certain individuals who are receiving Medicaid benefits for nursing home or community-based services at the time of their death are subjected to the estate recovery rule. It is a part of the Medicaid program requirements. This amendment updates and makes references to the department's new mailing address for personal representatives to make written notification at least 30 days before dispersing assets of a Medicaid member. The amendment also provides for a department email address through which personal representatives may provide the department with written notice. An opportunity for public comment was held on May 17, 2023. Written comments were due on or before May 24th, 2023. We received no oral comments and no written comments. That said, I am requesting your support for final adoption of the recommended rule changes to the estate recovery rule, rule number 111-3-8-.05.
Any questions, comments from the board? Hearing none, is there a motion for approval for final adoption?
Shane Mobley motions.
Shane Mobley has made the motion for approval. Is there a second?
Russell Crutchfield will second.
Crutchfield has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, and thank you, Sonia, for preparing the materials in advance. So we all had a chance to review those before your presentation, but thank you very much. We'll move on to the next item that Brian Dowd will give as the Deputy Executive Director of Policy Compliance. And this item will be considered for additional adoption, and he has two items, and you may proceed, Brian.
Thank you, Mr. Chairman, Commissioner, and members of the board. I am presenting today for initial adoption an elderly and disabled waiver program, an independent care waiver program amendment to increase all services in the waiver by 0.5%. Effective August 11th, 2023, with DCH board approval and Centers for Medicare and Medicaid Services approval, DCH is proposing to increase provider reimbursement rates for all services within the elderly and disabled waiver program and independent care waiver program by 0.5%. In the 2022 legislative session, DCH received funding to help cover the costs associated with fingerprint requirements for provider enrollment specific to the elderly and disabled waiver and independent care waiver program. At that time, both waivers were pending with CMS for renewal. Home and community-based waivers have to be renewed every 5 years, and it's often a little bit of a lengthy process. But both the elderly and disabled waiver program and the independent care waiver program are now renewed for another 5 years, which allows us to move forward with these proposed amendments. The proposed reimbursement rate change is expected to increase expenditures in state fiscal year 2024 by $1,297,039 in state funds and total funds of $3,817,065. An opportunity for public comment on the proposed change will be held June 14th, 2023 at 1 p.m. via Zoom. Individuals wishing to comment in writing on the proposed changes can do so on or before July 10th, 2023. If you have any questions, I would be happy to answer them at this time and would respectfully request your initial adoption of the waiver amendments to both the elderly and disabled waiver program and independent care waiver program.
Thank you, Brian. Any comments, questions from the board, please? Hearing none, is there a motion for initial adoption approval?
This is Dr. Lee. I make a motion for initial adoption.
Motion's been made for approval initial adoption. Is there a second?
Shane Mobley seconds.
And Mama has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, Brian, and we'll follow up when you're ready for the final approval. Thank you, sir. Next item to consider for initial adoption, Lynette Rose, Executive Director of Medical Assistance Plan, will make a presentation.
Good morning, Commissioner Noggle, Chairman Boyd, and board members. Again, thank you for the opportunity to present. Pending initial adoption from the board and approval from the Centers for Medicare and Medicaid Services, We are proposing to amend the state plan to include the coverage of blood pressure monitors beginning July 1st of 2023. Currently, the Georgia Medicaid program does not cover blood pressure monitors for fee-for-service members. Per the provisions of the amended state fiscal year 2023 Appropriations Act, the department was directed to revise its policies and procedures to allow for coverage of blood pressure monitors. The fiscal impact is as follows. For state fiscal year 2024, total funds represent $7.8 million. State funds represent $2.6 million and federal funds represent $5 million. An opportunity for public comment will be held on June the 14th at 11:30 a.m. via Zoom. Written comments are due on or before June 21st of 2023. I will pause for any questions from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Motion for approval, David Cruz.
David Cruz has made the motion for approval. Is there a second?
Second, Cynthia Rucker.
Dr. Rutgers has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, Lynette. Thank you very much. Lynette has some other items here that I believe two other areas are to give us an update on. So would you please proceed?
Yes, thank you. So we are presenting the next three items for the board's awareness. No action is required from the board at this time. I'll start with the expansion of express lane eligibility. Per the provisions of the amended state fiscal year 2023 Appropriations Act, the department was directed to submit a state plan amendment to the Centers for Medicare and Medicaid Services to expand express lane eligibility to include child care and parental services, refugee cash assistance, and the special supplemental nutrition program for women, infants, and children. We are drafting the state plan amendment at this time, and we are working very closely with our sister agency, the Department of Human Services, and our vendor Deloitte Consulting to identify all required system changes and policy changes. We will update the board once the state plan has been approved and the policy and system changes have been implemented. Moving on to the second item, coverage of routine.
Let me ask you, Lynette, is this an item, once that is written and you said approved, does that have to be approved by this board or this information?
Right, it does not. It will just come back informational only. Our eligibility spas such as this do not require board approval.
Okay, thank you.
So the second item, again, just for the board's awareness, relates to the coverage of routine physical exams and preventative care provided by federally qualified health centers and rural health centers. Per the provisions of the amended state fiscal year 2023 Appropriations Act, the department was directed to revise its policies and procedures to allow for the coverage of routine physical exams and preventative care through our federally qualified health centers and rural health centers. We acknowledge the directive and have confirmed that this is currently a covered service, thus no further action is required by the department. Now we'll pause for any questions, Chairman.
Any questions, comments? Hearing none, please proceed.
Yes, and the final item for awareness relates to the coverage of psychiatric facility services for persons under the age of 21 enrolled in fee-for-service. Per the provisions of the amended state fiscal year 2023 Appropriations Act, the department was directed to revise its policies and procedures to include psychiatric hospitals as an eligible facility type to provide inpatient psychiatric facility services for persons under the age of 21 years old, enrolled in fee-for-service. Again, we acknowledge the directive and note that this is currently a covered service and that the Medicaid program does enroll psychiatric hospitals as an eligible facility type. Thus, no further action is required by the department at this time. And again, I'll pause for any questions from the board.
Any questions, comments from the board? Very good, Lynette. Those sound like very good where there are changes, but also reconfirming that we have coverages in those areas. I think
Yes.
that's that all positive.
Yes, thank you.
Is there anyone from the board know of any new business that needs to come before the board at this time? Hearing none, I want to thank you again for your attendance and participation today. Our next meeting will be on July 13th. And thanks for the staff here that we had a flawless meeting today with no technical issues as we work through these things. So everyone have a good day, and our meeting will be adjourned. Thank you.